For the agent that must be in the know, Medicare Industry Insider discusses critical insight, noteworthy trends, and upcoming issues in the Medicare market.
Deciphering and debating the legislation, regulation, and what's happening in the market. I'm Jalen Jackson.
And I'm Rachel Brameyer, and we're going to talk shop, dive deep into these complex topics, and make them understandable and actionable.
If you've ever wondered where the world of Medicare is going and how to prepare for the future, Medicare Industry Insider is the resource you've been looking for. Welcome to another episode of Medicare Industry Insider. I'm Jalen Jackson.
I'm Rachel Brameyer.
And this week we're going to talk a little bit about veterans and how insurance agents can better work with and better serve the veteran community. There's over 9 million veterans in the United States over the age of 65, which makes up a huge chunk of the Medicare market. And they all face kind of unique challenges and considerations in getting coverage. Biggest thing we want to talk about today is kind of how to create an educated, do no harm approach to working with veterans that can serve everyone well and make sure that veterans have access to coverage that can benefit them without putting their earned care at risk. So definitely want to talk about how we can serve them, how we can improve outcomes, improve quality of life, and again, give them access. I think the worst thing an agent can do is be scared of working with veterans who have federal benefits and not give them the access and opportunity to have more choices about their care. Doesn't mean that you shouldn't proceed with caution and know what you're doing, but there's a lot of reasons to make sure that you are prepared to and equipped to work with veterans.
Yeah, and I think that's a good point, prepared and equipped, because I think in the past it was, veteran, throw your hands up, don't touch them, they have good benefits, we don't want to mess them up. That is very true. They do have excellent benefits, but I think having conversations with them, you may see opportunities to maybe enroll them in a Medicare Advantage plan or have conversations about access of care. And basically understanding the different types of veterans benefits will help you feel a little bit less scared and feel a little bit more equipped in order to help make sure that their coverage that they are currently in and what options that they can potentially have align. So I think that's a very good place to start then, is just going through the different types of veteran options, because I think clarification and a little bit of definition might help a little bit.
Absolutely. And I want to be super clear that this is not going to be an all-encompassing deep dive look at every way that a veteran might receive care. If you want that, look up the program manual for any of these benefit programs we're going to talk about. And I really do encourage you to bookmark those on your computer so you've got access to them if clients ever do have questions. But by and large, there are kind of three main benefits that we talk about when it comes to veterans. Probably the most common and easiest to work with for agents are just VA benefits. So typically available to the largest chunk of veterans that were active duty at some point, have service-connected disabilities, or in some case qualified based on income. And again, exact program guidelines, how people qualify. There are some nuance and complexity in terms of length of service, where and if they deployed, things like that. But again, in general, folks that were active duty and have some kind of service-connected disability do get VA benefits, which is kind of what I think most people think of when they think of veterans benefits, going to the VA. Going to whether it's an actual VA hospital or VA medical center, or now we have a lot of these kind of outpatient clinics with the VA as well.
So I think the biggest thing with an agent when you are talking to someone who has VA is giving them the option of enrolling in Part B or not. It's credible for Part D, which is perfect, but it is not going to protect them from that Part B penalty if they choose to pick it up later. So that is a very, very important conversation as an agent, just to make sure you walk them through, like, do you want to see civilian doctors and hospitals down the road, or are you comfortable using the Veterans Hospital and not picking up Part B? And I think that is, it's one of those things that sometimes people will say, I have, veterans benefits, it's great, I'm not going to pick up Part B to potentially never use it. But the issue is, if they wait, they potentially could get that Part B penalty, and then they're that's for life. That doesn't go backwards. So I would say that would be my biggest advice if you're talking to someone on veterans, because if they do want to see other potential civilian doctors, if you would they would need to pick up Part B, and then you can always put, Medicare Advantage that potentially could be $0 premium in that area, just to give them options to go outside of that veterans hospital. But I think that's one of the biggest things when people meet with those clients of a conversation to have with them.
Yeah, I would agree. And I think a lot of it comes down to an understanding of how, and this is true for all the types of benefits we're going to talk about today, but how it does or does not interact with Medicare. So VA and Medicare really don't talk. They don't work together. VA benefits work at VA facilities. Correct. There are limited cases through the community care program where you might see a civilian doctor and the VA would pay for it, but those are generally limited if there's extremely long wait periods at your local VA, or if you live more than a certain distance away from the nearest facility. So don't depend on that. But if someone, again, wants to see civilian doctors, wants more options for care, Part B and then potentially supplemental coverage, a Medicare Advantage plan, a Med Sup, could be a good option. And the good thing about VA benefits for agents is you're not going to mess them up.
Right.
There's not the concern that something you could do. Yeah, there's not the concern that something you could do could somehow negatively impact those benefits in most cases. Now, big thing to understand too in terms of suitability is just priority groups. So the VA ranks veterans priority groups 1 through 8 to determine kind of their level of coverage. There are actually the lower priority groups, the 7s and 8s, even the 6s to an extent, that may have some copays or coverage that is not available to them. And again, can be determined based on that level of disability, based on their income, based on whether the care they are receiving is related to that service-connected disability or not. So even someone who has a service-connected disability, if they need care outside of what that disability does to them, it may not be covered under their VA benefits in some cases. So definitely might consider getting excess coverage or Medicare coverage so they maybe get those extra benefits on an MA plan or a Part B give back, or even just speed of care, being able to access care more quickly.
And that's been really one of the biggest things is just like, I can't get into the veterans hospital and now you've only got that one option, or maybe the closest veterans hospital is so far away. So it just gives them more choices. And let's say they do get a chronic condition like cancer, it gives them the ability to go other places or to civilian doctors if they need it.
Yeah, so
absolutely. I like your terminology of it. You can't mess them up really. So
yeah, to an extent.
To an extent. It's nice that, you can work with them. Like I said, the biggest conversation topic is going to be, do you want to pick up Part B now? Even if they choose like, I don't want anything else, but I want the option down the road. Maybe you just talk them into potentially picking up Part B so that they have a choice down the road. Or if you don't, the worst thing is that they come back saying they do want to go see civilian doctors and maybe expand their network, and you didn't talk to them about that Part B penalty. That can be a negative thing. So making sure that you at least have that conversation with them.
Well, and I think to wrap up VA benefits and put a bow on this one, the big thing I want agents to remember is not every veteran has had good experiences of care. The VA system, VA facilities have had a bad rap in the past. They've had a lot of issues with access to care, quality of care, and it depending on where you're at in the country, the perception of the VA can be drastically different. Here in central Missouri, where we're recording this, we have been incredibly lucky. Our Truman VA right here in Columbia has been one of the top ranked VA facilities in the nation year after year after year. So we have a lot of folks that love the VA here in Columbia. In other parts of the country, that is not the case. So just because a veteran has access to the VA, don't assume that's where they want to go. So I think that's kind of the big takeaway for VA benefits is this is about providing options and choices for care and not assuming that they want to always use those benefits they qualify for.
Perfect. So the next one you probably run into quite a bit is TRICARE for Life. It is credible for Part D as in dog. You have to have A and B of Medicare to keep TRICARE for Life, and it is something that files claims after your other health insurance. So it is only primary if your insurance denies a claim. So basically you have to have additional coverage. TRICARE for Life is for people who are retired military, so they worked at least 20 years in the military. And some spouses and family members also are included under that TRICARE for Life umbrella.
Yep. And like anything, always some exceptions. Generally, that 20 years of service, medical retirement, potentially some other things. And this is a coverage that they have TRICARE and its various forms while they are in the military, and then even into retirement if they retire before 65. But once they become Medicare eligible, it converts to TRICARE for Life. And again, they're required to pick up A and B. The best thing is it's wraparound coverage. TRICARE for Life is going to cover copays. It's going to cover out of pockets. It's going to cover everything beyond what original Medicare covers. Generally covers drugs with extremely low copays, no donut hole, no catastrophic coverage phase. It is, by and large, really fantastic coverage. It is, like Rachel mentioned, going to pay secondary to everything except Medicaid. So, for example, it will pay after Medicare. If you do have other health insurance, OHI is the common terminology, it will pay after that other health insurance. And the big thing here, and this is where it gets tricky, people really need to understand, because this is a coverage that you can mess up if you don't understand what you're doing. If someone does have other health insurance, OHI, you got to follow that plan's rules.
Correct.
In general, if your plan, for example, you enroll someone in a Medicare Advantage plan, if that plan denies a claim, TRICARE will also not pay that claim in most cases. Again, exceptions to every rule, but in most cases, which means if you're enrolling someone in a Medicare Advantage plan to get that Part B give back, to get those extra benefits, things like that, that can be a good choice. But if someone's on one of those plans and goes out of network and doesn't have coverage, TRICARE's not picking up the difference. If they stay in network and the plan covers everything, no problem. TRICARE will in general pick up that difference, pick up those copays, those coinsurances, and in many cases, the provider is willing to file that for the beneficiary, but they're not required to. So understanding that those beneficiaries may have to file to get reimbursed by TRICARE for those out-of-pocket costs. So definitely a lot more to consider. One of the biggest benefits, again, the drug coverage on TRICARE for Life is exquisite. I want to make sure, and again, want to look at this as unique to each individual client. But in general, I would say it very seldom, and I'm talking 99+% of times, very seldom makes sense to put someone with TRICARE for Life into something that includes drug coverage, because they then lose access to that meds by mail program that offers them extremely low or no cost drugs.
Right. I think you hit on some really good points, from the drug aspect all the way over to that it is a Medicare wraparound coverage, which that is a term that you'll hear. It's one, even if you look in TRICARE for Life brochures, things like that. So that is a technical term. But essentially making sure that it's pretty good coverage, and just having a conversation with them of what extra things do you want? Is it freedom to go outside of, the Veterans Network? Is it Part B give back? Is it some of the extra benefits that they're looking at? And some of the risk versus reward, like the networks, they have to follow that MA network. So I think you did a really good job of kind of encapsulating pros and cons of additional or other health insurance being included in this.
Yep.
So this one, definitely take a look at that particular client and make sure that you're doing what they feel is the most important thing for them.
Sure. And I, again, look at this from a do no harm perspective. So, I mean, with just TRICARE for Life and original Medicare, they can see any doctor that accepts Medicare. They don't have a network to speak of. So are they willing to narrow their choices in exchange for a Part B give back, all the extra benefits that MA offers? I will tell you, there's no reason that I can think of off the top of my head to write someone with TRICARE for Life a Medicare supplement, because it would just be a supplement on top of the supplement they already have. Right. But you will occasionally see folks that want, say, an MA only plan that does not include drug coverage, so they still have access to meds by mail, and they can get those extra benefits, the gym membership, the OTC, the transportation, all of those things. That can make sense, but again, want to make sure they understand what they're giving up to get access to those extra benefits.
Which brings up another good point of there are a lot of carriers specifically creating MA plans just for this particular situation. You'll even see like the name of them be like Eagle or I don't know.
Eagle, Patriot, Honor.
Yeah, Honor. You'll see all the like military terminology and names in their plan. That's why they're building these plans specifically for other health insurance for your veterans.
Mm-hmm. And again, TRICARE program manual has some great information. There's an entire section on other health insurance, OHI, and how it's impacted. The last one that we want to talk about in terms of veterans coverage is one you may not run across as often. And I would say two things about CHAMP VA, which is the last one we're going to talk about. First of all, a lot of people really misunderstand this coverage. Also, this is probably one that you may have clients in your book of business right now that qualify for this coverage and have no clue that they do. And you can provide one of the most valuable services, if maybe uncompensated, unfortunately, by helping folks realize whether or not they're eligible for this. So CHAMP VA is a unique coverage. It is Part D creditable, requires Part A and B of Medicare to have and keep CHAMP VA, but it is primarily coverage for spouses and children of fully disabled or deceased service members, and to sponsor service members not eligible for TRICARE. So these are veterans who were wounded in the line of duty or somehow injured or became gravely ill due to their service, and became fully disabled. Their spouses and children are who gets CHAMP VA. And then again, in some cases, service members themselves that aren't eligible for TRICARE due to the various ways that those can be qualified for.
And this one's also secondary to Medicare and other health insurance except for Medicaid, same as TRICARE for Life. So just keeping that in mind as well. It functions very similar, especially with the network. So like we talked about with the TRICARE for Life, you have to follow that MA network if you choose to put them in that.
Yep, it is. And again, it is very, very similar to TRICARE for Life. It is focused on the families of a veteran. Again, some veterans, but mostly families. And here's again why I say that it is really important to understand this one in particular. If you have clients in your book and you know their spouse was a veteran and that spouse is not around anymore because they've passed away, you really need to do a little digging. Because if that person has passed away due to a service-connected illness, what they may have only been qualifying for, they don't have to have had TRICARE for someone to have qualified for CHAMP VA. They could have VA benefits. They could have not even applied for benefits necessarily. But if they passed away due to a service-connected disability, it is very possible that that client of yours may be eligible for CHAMP VA, and you can provide them with some of the best possible coverage available. Again, Medicare wraparound coverage acts exactly like a Plan F. It's going to cover all the copays, all the co-insurances, zero out-of-pocket costs. It's going to give them access to meds by mail. And again, if you are considering adding some kind of additional coverage to this, understand the impact it can have. Again, nothing with drug coverage in my opinion because of that extremely low or no cost meds by mail program. Looking at are those extra benefits like Part B givebacks, gym memberships, over-the-counter transportation, is it worth that reduced network access? Really the exact same story as TRICARE for Life and whether or not something extra makes sense. But again, the biggest takeaway for me with CHAMP VA is you probably have clients that qualify for this that have no clue, and you can provide them an incredible benefit by doing a little bit of digging. In any of your clients that you know have a spouse that was a veteran that isn't around anymore, just ask a couple basic questions and see if you can provide them some incredible extra benefits.
So I think to summarize, we talked about three big ones: veterans benefits, which is a big one that you hear a lot about, which is gives you a little bit more opportunity to help. And then TRICARE for Life and CHAMP VA with very similar stories of just specifically making sure you're not disconnecting them from their Part D, as in dog, for their drug plan, and then also doing the weight of what is more important. Is a smaller network worth all the extra benefits a Medicare Advantage plan might give them? So with that, I think we talked through kind of some of the big things, and I think you hit on another one, which is just like, what is their experience and perception of the VA hospital? Because adding additional coverage gives them the ability to go outside of the veterans hospital as well. So essentially, we've talked about access to care. We've talked about how it works. Other things to consider with insurance-wise, it's kind of similar to like anyone else who would pick up just a Medicare plan, standalone Medicare plan. You're looking at what does Medicare not cover, kind of the same thing with them. You'd want to have additional conversation on like dental, vision, hearing, on home health care, all those extra things that normally Medicare doesn't cover.
Well, and I would say with veterans, it takes a little more research. So like in general, with the core medical coverage that we just discussed, it's again, balancing extras versus access. With everything else, it's balancing what they may already have available. Back when I was out in the field as an agent, I talked to so many veterans that their genuine plan, someday if they need care, they thought, well, I'll just go to the veterans home, which is fine. We have 8 state veterans home here in the state of Missouri. Many states have others. They're state-run facilities, but they service our veterans for long-term care needs. Right now, it's about a 2-year wait to get into one of those. Which is not ideal.
No.
So in most cases, people do need to still have a long-term care plan. And we see it time and again, just like anyone else, not unique to veterans, forcing that family to become a caregiver, whether that's a spouse or kids or someone else, can be incredibly burdensome on their own health and well-being. And that's not what anyone wants. No one wants to feel like a burden or feel like they have burdened their family. So looking at some of those other options, dental, vision, hearing, that may not be covered very well under the VA or other benefits, life insurance. They may have access to life insurance through the VA or through the Department of Defense. There's some great programs specifically for veterans to get them access to some level of life insurance. But they may want additional coverage, or they may have missed an enrollment window for that. So it's still a discussion to have. And then cancer insurance. Even if they have this fantastic coverage, there's always going to be those non-medical costs, those costs of travel, costs of staying in hotels, costs of, other non-medical costs that they may need to cover. So cancer insurance is definitely still a conversation to have. And again, I think the biggest thing for agents to understand, I want people to really understand that someone can have really great health insurance like TRICARE, like CHAMP VA, like VA benefits, and still have needs. I think the narrative for too many agents is, oh, they're veterans, don't touch anything, don't take advantage of them. You're providing the same service that you do to every other client by looking at all of their needs, all of their options, and making an educated and informed decision with them on what makes sense for their situation.
100%. I think that is one of the biggest things, is just making sure that you are actually taking a look at them as an individual, and that you're setting them up with something that fits their needs and fits whatever is important to them. Like you said, they may have had a horrible experience with the veterans hospital and may want to go someplace else. So it's definitely one of those things that you want to take a look at. But in addition to that, a lot of the veterans have extra benefits. Also, we talked about some things that are not covered, like long-term care, dental, vision, hearing, things like that. But they may have extra things like burial benefits included. A lot of them will get to a certain amount of dollar figure to bury, or they can get buried in an actual veterans cemetery. So, and they are usually all, like, the headstones all look the same. They're very well lined out. So if they are interested in something like that, that's an option.
Well, and I think one that's kind of a little odd fact is even if someone doesn't want to be buried in a veteran cemetery, really common to do, kind of the honors ceremony, drape the casket.
Oh, that's a very good point.
One of the odd little services provided by the U.S. Postal Service is they actually provide the flags for draping on caskets. So if you've got clients or just in your community need to have that as a resource, you can actually go to the post office and get a flag for draping over the casket of a deceased veteran. So that's kind of a really interesting little benefit. And there's a lot of resources out there. We talked about CHAMP VA, and I talked already about paying attention to those clients that had veterans as a spouse. Another thing is dependency and indemnity compensation. There is a lot of money out there to help spouses of living and deceased veterans with the costs of their care. So looking at veterans pensions, whether or not someone qualifies for one, that even if they have maybe applied in the past, a lot of times the qualifications, the numbers, things change. And with most veterans benefits, it's very proactive. You have to apply periodically to make sure you're eligible. It's not like something like LIS with Medicare where you can be automatically enrolled if you qualify. Veterans benefits require action in most cases. So even if they've applied, even if they've been denied in the past, there may have been changes either to their status or to the program rules that can get them those additional benefits for their family and for themselves.
I think you already mentioned veterans homes, but like you said, sometimes there can be a very long wait for them to get into it, but it is an option. And then of course, caregiver resources. There are so many things out there, resources online, to help those caregivers if they end up in a situation where they are servicing and taking care of that veteran, which unfortunately, if they don't have a long-term care plan, that potentially could be something that they are leaning on. But I think as we went through all of this, some of the big takeaways that, and we can both chime in, but looking at what is available in your local area is going to be extremely important. Understanding the three big veterans options and what you can do and what you probably shouldn't do in order to service them better as an agent is going to be incredibly important. And there are so many networking opportunities, and I'll let you brag on Fisher House, but you were very, very involved in Fisher House for years. And that's a huge opportunity to kind of get involved with veterans.
Yep. And I think the takeaway for me is if you're passionate about serving this community beneficiaries, and again, 9 million people is nothing to sneeze at, and that's just the folks that are over 65 that are veterans and likely Medicare eligible. But, find ways to give more than you get. There's a lot of opportunities to get involved in the veteran community, either through a local veteran service organization, your local American Legion or VFW. I don't care how small your hometown is. It has an American Legion or a VFW, never both. For some reason, you're always in a Legion town or a VFW town. Like they don't always have, both in the same town, it seems like. But you can find them all over. And then, Fisher House. That was a passion project of mine. I was on the board of the local Fisher House, which is, kind of Ronald McDonald House, but for veterans. So a place for veterans and their families to stay while they receive care. Again, a lot of veterans live more than 2 hours away from their local veterans facility. So they're doing a lot of traveling, and that can be very tiresome, especially if you're getting chemo, getting daily treatments of some kind. So provides a great place for them to stay, and kind of heal at home, even if it's a home away from home.
And you even worked on getting one created and made, like built in our community, because there wasn't even one available. So if you are looking around and you're like, wow, there isn't a Fisher House, maybe that's another opportunity is like, okay, let's get one here. So
if you have questions about Fisher House,
yes.
Give me a call. You know how to get a hold of me. You all have my contact info somewhere.
I love it.
But just wrapping things up, putting a bow on it. Again, a lot of veterans may have had bad experiences with the coverage that they're offered. So even if someone has these benefits available to them, don't assume that they've always had good experiences. Don't treat them differently than any other client. Don't let their veteran status cause you to not do a full and complete needs analysis just like you would do with anyone else. I think oftentimes that fear leads to uncertainty for you as an agent, fear of messing something up, fear of not understanding their coverage. Don't let it stop you from doing a complete and total needs analysis like you would for any other client. Make sure that you're offering them better access to care if you're offering them some kind of a different coverage, and make sure that you just talk to them. Learn what they're struggling with. Learn what parts of care they are looking for solutions for. And then at the end of the day, you can use all of the tools available to you to figure out how to complete that puzzle, to build that really package of protection for them and give them the options that they're looking for. I think that's probably one of the most critical things we can do, just find solutions, find options for our veterans. And as always, we really appreciate y'all listening, and we'll be back next time with more info.